Hi everyone! Today I will give a detailed comparison of the success rates of day 3 versus day 5 embryo transfers. Today the general trend is to make the embryo transfer on day 5, in other words making a blastocyst transfer after oocyte retrieval. But this trend may affect the outcome, and in special circumstances, day 3, even day 2 cleavage embryo transfers are beneficial. First of all, we know that blastocyst transfers tend to have higher implantation rates because the embryos are more developed and have a better chance of surviving the transfer process. Studies indicate that day 5 transfers have implantation rates of around 50 to 60% depending on the quality of the embryos and the patient's individual circumstances. When it's a day 3 transfer, we see a tendency towards slightly lower implantation rates, typically around 30 to 40%. In day 3 or day 2 transfers, there is always a confounding factor which forces the clinician to make the transfer as early as possible against all odds. Because of those confounding factors like diminished ovarian reserve, advanced age, previous transfer cancellations due to insufficient blastulation, the embryos are less developed and it is harder to assess their quality compared to day 5 embryos. But if this is the situation, placing the embryos in their naturally lower oxygenated uterine environment on day 2 or 3 instead of culturing them towards day 5, certain cellular growth disturbances caused by external environmental stress issues may be overcome and more likely end with a pregnancy. Nevertheless, if your lab's blastulation rate is well above benchmarks, overall aim is to extend the embryo culture to day 5, so that stronger embryos will be selected naturally during this course and higher pregnancy rates per embryo will be achieved. But although today, day 5 blastocyst transfer is the aimed and desired transfer policy, subtle changes always must be taken into consideration according to the couple's special conditions and previous treatment histories. I wish you all a good day.